jobs as educators that we have is to educate our students on the choices that they have. We talk to students every day about college choices, career choices, class schedule choices. But just as important as those conversations are important questions about choices and challenges they may face that may negatively impact their future. About a year ago, I think, Dr. Squire came and talked to the Olentangy Local School District's administration team. And I remember when I left there, I thought about his message for 2 or 3 days. And as a principal, I'm always looking for people to come in and educate my students and arm them with knowledge and skills so that when choices and challenges come towards them, they make good choices. And since his message resonated with me so much, I asked him, could you please come in and talk to my students? And he very graciously agreed to come in. He will be joining the Orange Pioneers next week in class meetings. And we definitely wanted to open up this opportunity to our community and our parents. And before we begin, I officially introduced our speaker. I want to let you know that, Dr. Farr, I'm sure that you have very long days. And I'm sure that some of those days are stressful, and I understand you have a very young family. And I want to personally thank you, because I know you're taking time away from your family, and I'm sure that you're tired and you work a lot. I can't thank you enough for partnering with Orange High School, with our communities, and hopefully many, many more districts after this experience. So if you could please put your hands together and welcome.
Thank you. First and foremost, let me just kind of introduce what we have here. I'm going to move around a lot. I can't sit still. That's why I work in emergency medicine. I also get interrupted a lot at work, so if someone has a question, please don't feel like you have to wait till the end. We'll have time at the end, but please just interrupt me because that happens every day at work and at home. So if we back up about a year and a half ago, we at the American College of Emergency Physicians Ohio chapter were in a board meeting talking about what can we do to kind of help get our message from emergency medicine across. And amongst many possibilities, the opiate issue came up. We've been seeing it head on for years. And we thought, what better way to get out of our departments and get out into the community and educate people about what we see, that people are getting small snippets from the news and what's actually growing at an exponential number, and frankly, scares the heck out of me. As a dad, I don't want my kids to see this, and I don't want them to be affected by it. So, we spent the last year kind of meeting with different people, the Attorney General's office, meeting with Orange High School, meeting with a number of community members, trying to figure out what's the best way to get this message across, what do people need to hear, and what's really going to resonate well with high school students so that this message can get out there and can change their mind about something that is destroying lives across the country, but really hitting home in Ohio. We talked next week, anybody who's a parent of a student at Orange High School, your kids are going to be in the presentation on the morning of the 28th. So I'd ask you to put a reminder on your phone. Great evening discussion to have with your kids. Bring it up, whether you're going to sports practice or sitting around the dinner table. This is a conversation you need to have with your kids because it could very well prevent a discussion that, frankly, I hate having. I hate having to step into a family room in the emergency department and share with families that their child, their husband, their mom, their dad has died from an overdose, something that could have been prevented. And unfortunately, we see it on a regular basis. John's one of my coworkers at Riverside. I work for a group that staffs Riverside, Grant, Dublin, and we work in Westerville and Pickerington, and I can tell you that the opiate epidemic hits everywhere. This isn't just in the inner city. This hits hard in the suburbs, and I see it equally everywhere. Yesterday, NBC4 came in for an interview around 11 a.m., and wouldn't you know it, in the time that they were there, we had an overdose come in. It happens every day. And that's the big message I need you guys to understand. We heard about Zika, we heard about Ebola, but realistically, those are not a huge risk for your kids. Not like this. 2 people died from Ebola. How many people heard about it? None of you guys watch the news. But everybody, it was everywhere, everywhere. 3,050 people died in the state of Ohio from opiate overdoses last year. And we're not talking about it the same way. So, we're going to move forward. So as I said, I'm from the Ohio American College of Emergency Physicians. This is our NIX opiate campaign, which we're going to try and push across the state with emergency physicians. We represent a group of about 1,500 ER doctors in the state of Ohio and a national chapter, which is a multitude larger. And this is us kind of speaking about what we see on a regular basis and talking a little bit about the science behind this drug and what makes it a little bit different and really what scares the heck out of me and should scare the heck out of you, and you need to talk to your kids about it. So we're going to talk about a little bit about what opiates are, why it is that you need to care about them, what they're going to do in the body, and then kind of what do I see in the emergency department. We talk about overdoses, but that's only a small snippet of really the larger picture. So who am I? I'm an Olentangy resident. Every ER doctor goes through 4 years of undergrad, 4 years of medical school. Then we do a residency about this last 3 to 4 years. I am from Toledo originally. I went to medical school in Toledo. I trained in Akron, which has been on the news a lot about opiate overdoses. And I moved down here to Columbus and worked with arguably one of the best, most intelligent groups of ER docs in the country with Mid-Ohio Emergency Services. And I encounter this every day. As I talked about briefly, I work in all aspects of the Columbus area and I see it everywhere. And there's no area that's not hit by this. And there's no area of the state that's not hit by this. And this is something you really need to understand. If you don't think opiates are in Olentangy, they are. I've had open discussions with high schoolers who have rotated with me through the emergency department, and they've told me that in some instances it's easier to get a handle on opiates than alcohol. And that's scary because this is bad news. So what are opiates? Heroin is, yes, heroin's the big one, but there's a whole slew of prescription opiates that you need to be aware of as well. That are equally as dangerous and are pretty much the same chemical compound. So when you talk about, many of you that may have smaller children may know Tylenol 3, which the American Association of Pediatrics came out with something earlier this week recommending that no children under 11 should have codeine. And they've been saying it for the past 3 years, but this is big. It's also things that are prescribed by doctors like myself, and things that people need to understand you have to use cautiously. Things like Vicodin, Percocet, things that many of you may or may not have in your medicine cabinets at home or may have taken in the past. Things like Dilaudid, oxycodone, and then you've got methadone. But you need to remember this list, because the opiate epidemic is not just heroin. And that's an important thing that you need to remember.
Well, we got you all patched up. I'll give you a script for some ibuprofen, and that should help with the swelling.
Don't you think she may need something a little stronger?
You mean like this?
I don't think so, that's crazy.
Do you know that most prescription painkillers like Vicodin and Oxycontin are opiates, and they work just the same as heroin? And if not used sparingly, can lead to heroin addiction.
You know what? She's tough. We're just going to stick to the ibuprofen.
Sounds good.
Unfortunately, that is a very real discussion I have on a daily basis. I make it a habit personally, I don't write any type of narcotic for any child that's under the age of 18 because of that reason. Our bodies are wonderful things. Our bodies tell us if something hurts. If you have an ankle sprain and it hurts because it's telling your body saying, don't walk on me. If your stomach's upset, it's upset and it hurts because it's telling you, hey, you need to settle down. You can't eat a bunch of stuff right now. Something's going on. A lot of times when we use narcotics, they're covering things up, and there's a risk of re-injury, and there's a risk of injuring yourself by using that medicine. So we talked about, this is organic chemistry, which if anyone took that and you love that, you're better than me. But the big thing to take from this is, similar dogs bark the same. And so when you talk about codeine and morphine, this looks the same as heroin when you break it down to the chemical compound. So it's the same basic drug. So how do opiates work in the body when we take them? Whether it's heroin, whether it's oxycodone, whether it's Dilaudid, morphine, how do they work? The big thing that any type of opiate does is it causes release of dopamine in the body. Dopamine is essential for happiness, for pleasure, for people's memory. And when that happens, normally our body gets used to a normal release of that. When someone takes a narcotic and an opiate, it causes a massive release of that. And so an up release of that dopamine in our body, resulting in essentially that pleasure feeling that comes with using the opiate. But when we start using that, our body gets used to that overload, that excessive amount of dopamine, and that normal amount that we used to be able to use to be happy, whether it was that dopamine release from the kids that are outside playing volleyball right now, or outside on the football field, who they're releasing dopamine in their system by working out, because it feels good. But this, in turn, is causing that normal release. It doesn't work anymore. And you need that upregulation. And that's where the addiction to opiates is different than a lot of the other drugs that are out there, because they cause that massive release of dopamine in the system. And the people that become addicted, which is a huge handful of people that start using it, they get so used to that dopamine upregulation. So, as we talked about, the dopamine release from opiates causes this massive system overload that everyone's body becomes very accustomed to, and we're going to delve into the addiction component of it in a little bit, but that's the big thing to understand about when people are becoming addicted to opiates. It's that huge release of dopamine, and then you're not used to what really makes you happy. So they really are going to change fundamentally people's brain activity. So why should we care? Why should we here in Olentangy School District care about opiates? Well, frankly, in the past 15 years, we've seen opiates explode in Ohio. Ohio is shamefully one of the worst states hit by the opiate epidemic. There are deaths in every county, and Delaware is not hidden from it. Franklin County's hit hard. You can't really see the numbers here, which it doesn't really matter in the sense of knowing those exact numbers, because frankly, it's not a straight line anymore. We're seeing an exponential increase, and it's upsloping right now. So in 2015, specifically Delaware County, there were 13 overdose deaths from opiates. And Franklin County, there were 279. And the important thing to understand about that, though, is even though the Delaware County seems lower, the Narcan administration, which many of you probably seen on the news, it's now available over the counter from CVS. Most recently, I think it's $15 over the counter for a reversal agent for opiates. That has seen an increased use as well, by like 5,000 doses in 2015, by EMS alone. So we've gone in the past 15 years from a death rate of 5 per 100,000 citizens in the state of Ohio to 30 per 100,000, which is, it's disturbingly, it makes you stop and think, what's going on, what's changed in the past 15 years that we're seeing this. And then the Attorney General just came out this week and published something about how in the 70s, when opiates were around, it was still taboo. It wasn't what it is nowadays. I have to admit I wasn't alive in the 70s, but this is not taboo anymore. It's used, and it's used mainstream, and it's increasing popularity across the board. We're seeing increased death rate, which this looks like a straight line, but that was through 2010. I'll tell you, this year, in the year 2016, I think with what we've seen with the carfentanil, which is an elephant tranquilizer that's being placed and mixed within these, as well as fentanyl, two different types of opiates that are longer lasting than what's typically cut in the heroin, has resulted in an exponential number of deaths. And I'm afraid that our number is going to be close to 3,500, if not 4,000 this year, from 3,050 last year. So who's affected? Frankly, everyone is. This isn't a race-specific, this is not an age-specific drug. I see people that are teenagers, and I see people that are in their 50s and 60s who are overdosing. I'm not saying just using, I'm saying overdosing. There are stories in the news with the family members of a child who overdosed in the vehicle. There was a grandmother who overdosed in a grocery store and passed out next to her grandchild. There was the same thing with a grandmother who had her foot on the brake and overdosed with a 2-year-old grandchild. This was in the news this week. And we're seeing this all the time. And unfortunately, I think we're getting kind of blunted to the fact that it's there and it's in our face. And we're seeing it everywhere. September 11, 2001. I think everybody remembers where they were. I remember exactly what I was doing. I was in school at the time. I remember the class. I remember watching it unfold that morning. There were 2,753 deaths that day from the attack. Arguably the worst terrorist attack that we've ever and hopefully ever seen. In 2014, there were 10 times as many opiate overdose deaths in the U.S. In 2015, there were 3,050 overdose deaths in Ohio alone. There were more deaths in Ohio from overdoses last year than there were the people that died in September 11th. And yet, we're not talking about it. So these aren't just numbers. They're mothers, their fathers, their sons, their daughters. Their neighbors. Everyone here, I imagine, probably knows someone that's been affected by this epidemic. I know multiple people personally. I know friends in high school who have died from it. I know physicians who got caught up in it. I know physicians who are in prison right now because of it. It's very real. It's tangible. And if we don't talk about it and acknowledge it, more people are going to die.
All right,
I guess to explain how I ended here, we have to go back. I was just an average kid. I had a great family, good grades, bright future was ahead of me. You see, when we're young, we never think that this could be us. But the stories we hear that will affect our lives, where we're going. You see, no one ever sets out to make bad choices. But in the end, all choices have their consequences. How was I supposed to know? The one decision could affect everything I had planned for. Not all decisions in life are difficult, but some can be life-altering. Little did I know that decision could have been my last. After that, everything was a blur. Lights, sirens, faces, voices I didn't recognize. Everything unfamiliar. Yet among all that chaos, one thought came to mind. What would my friends, what would my family think of me right now? And would I ever get another chance to tell them I love them? There's a brief pause, stillness in the air, a sense of weightlessness. Felt as though I was dreaming. I could hear the faint sounds of actions around me, but I couldn't place them. Unsure of where I stepped or where I was, I couldn't tell if it was a nightmare or my new reality. If I could just get one more chance, one opportunity to do things differently, I would make the right choice this time. I guess to explain how I ended here, we have to go back.
So that's one kind of brief portrayal of what an overdose looks like when they come into the emergency department. Unfortunately, when I see overdoses, the story is many times very much the same. They come in by squad, or they get dropped off by a group of, and I say quote, friends, because no one comes to visit this person during their stay in the emergency department. We do everything we can to save that life, and most often it's very rare to see anyone coming to visit that person, anyone that's worried about them and whether they're okay. Even the people that they were with, if they call 911, they scatter. The paramedics get there and there is no one there. And that's what this drug is that's different than anything out there, is this is lonely. And frankly, that's what it is. You see these individuals who just were on the brink of death in the emergency department. No one's in the room caring for them. No one knows what's going on with them. And unfortunately, that's because many of the individuals that get hooked on heroin and get hooked on opiates will throw everything away. Whether it's their kids, their jobs, their parents, brothers, sisters, they don't care. Because all that matters once you get into that addiction cycle is your next fix. To the point where I've had it so often that people tell me, you know what? I don't even use to get high anymore. I use to feel normal. Because they can no longer live their daily life without using that drug. Now talking about high school students. Why does it matter to high school students? Because many times this may be their first exposure. And this may be a time where we can have a discussion with them before they go off to college and may be presented with that. And it's a time that we, as parents, as teachers, as physicians, we need to have that open discussion with the kids because it may make a difference if they're presented that. In 2011, they did a risk behavior survey amongst high school students. And they found that 21% of Ohio high school students were abusing prescription drugs. 21%. And along those same lines, almost 50% were using narcotic pain relievers and abusing them. That means more than 10% of high school students were abusing opiates. Unfortunately, that number is not any better today. Most recent data has come out and said it's actually closer to 1 in 7 are abusing opiate prescriptions. And that's scary. Because I venture to say anybody who's got a high school student, they probably have more than 7 friends. And to think that maybe one of those kids might be using, and that may be that their exposure, you have to be aware of that. And it's better that you have that discussion with your kid than their dorm mate in freshman year in college or their friend after at a football game on Friday night. So what does that mean across the country? That means 2,700 teens are abusing a prescription drug each day for the first time. Each year, that means almost 1 million new cases of abuse, and 80% of the teens that are abusing prescriptions are getting them from family or friends. So what's that 1 million number look like? Anybody that's been down to the shoe for a football game, if you took, this is assuming that a different person fills each seat at each game, but if you took every single person that went to every home game in 1 year, you'd still be shy of that number that are abusing prescription drugs, teenager-wise, each year. And that's a lot of people at the Ohio State football stadium. So when we talk about Ohio, we talk about prescription drug abuse and heroin abuse. In 2014, 80% of overdoses, this is all overdoses across the board, involved opiates. So, and again, opiates are not just heroin. Opiates are prescription drugs and heroin. And if you break that 80% down, you actually have about half and half of prescription drugs and heroin. So these overdoses we're seeing on the news, these are not just heroin. That's the big thing you need to understand. Because there's a big danger lying within our homes. So opiate addiction follows a very natural course. I've had many open discussions. In the emergency department, people have no problem discussing anything with us. I love it about my job. And I try and have open discussions when I have people who are addicted to see what it is, if we can help them in some way, because frankly, treatment resources are limited. And it's not infrequent to have someone come in that has some sort of issue. Probably the most frequent one is abscesses, which are infections under the skin. And talking to them while I might be doing an incision and a procedure on it to drain that infection. And the progression of their disease is predictable in almost every single way. It's not uncommon for someone to get a prescription for pain medicine and maybe not use all of it. And maybe put it in the medicine cabinet in case they, quote, need it at a different time. I frequently encounter individuals that share just that story. But that's something we need to be aware of. If you have that medicine, just putting it in your medicine cabinet is a dangerous place for it to be, especially if you have kids in the house. So when we talk about medicine cabinets, the danger with these medicines, and many times can be just as dangerous, if not more dangerous, than having a gun in the house. Than having, liquor cabinets. I know with many parents who have older kids, they might go away for a weekend and they think, oh, I gotta lock up the liquor cabinet. Just because I've got a high school, I gotta make sure that's locked up. But is the medicine cabinet locked up? Because there's things in there that are being abused just as much, if not more, and it's easier for them to hide it. And so, most of our prescription bottles are child-proof so that our young children can't get into them, but we really need to work on making sure those medicine cabinets are young adult and teen-proof, and that there isn't something they could potentially harm themselves with. So that talking about medicine cabinets comes from the fact that opiate abuse has a natural progression. Most people that are out there using heroin didn't just decide one day, I'm going to go out and I'm going to shoot up heroin, because that looks like a fun thing to do. It's a very predictable course, and in speaking with many of the people that I encounter on a daily basis, this course starts with prescription drugs. Whether they were prescribed them or they're buying them illegally off the street, which happens in many instances. They're purchasing those drugs and they are using them recreationally. They find that they have to use a larger and larger amount to get the same effect, which goes back to that dopamine upregulation in the body. At the same time, using a pill is more expensive. And if you go back and you look at the evolution of opiate abuse in the state of Ohio, the cartels played a big factor in this. They actually, if you go back 15 years ago, there were studies and there were stories on 2020 about OxyContin. I think Jack Osborne's was on there. And they kind of flooded the street market with that. But that's really expensive. The pills are really expensive to get. And so what's cheaper? Heroin's cheaper. So many people who begin using these drugs and the pills recreationally realize eventually, well, their dealer might not have it. But I've got this heroin, why don't you try it? And so they buy it and it's cheaper. And they say, you know what, I'm just going to smoke it, I'm not going to inject it. I'd never inject a drug. They find that they're smoking the heroin and it's not having the same effect. And it's that natural progression. The next thing you know, they have an IV in their arm and they're injecting. So now we get to kind of where in our body, what does this affect in our body? Opiates affect our whole body. Every body system is affected and affected differently. So when we talk about appearance, opiates have a horrendous effect on appearance. One, people don't care about anything but that next high. So they will throw everything to the wind. And their appearance is obviously included in that. But the other thing, too, is where people inject. People will skin pop and develop abscesses, which are infections underneath the skin. Unfortunately, the people that are making heroin are not good people. We found that out with, crocodile was around about 2 years ago with kerosene mixed in it, causing a slew of necrotizing fasciitis, which is an infection that results in your skin eating away. And you have to go to surgery to have your skin pretty much torn away from your body until we find out where it's no longer eating away. People require fasciotomies, which is where you have to have a limb of your body, opened with a knife because the pressure is so great from the infection in the muscle there. It's not uncommon to require some sort of amputation because of the infection that has occurred in that area or has been sent to that extremity. These aren't pleasing to look at, but I see them every day. This is one thing I can tell you. If you spend a day with me, whether it was at, in Dublin, if you spend a day with me at Grant, at Riverside, down in Pickerington, Westerville, if you go out in, rural areas, if you spend one day in an emergency department, you'll see this. Hands down. I'm not a betting man, but I guarantee you'd see it. So opiates affect sexuality. They're going to result in infertility in both males and females from long-term use. When we talk about central nervous system, we go back to a little bit about the potential for infection going throughout the body. And this, in IV drug abusers, there's a potential for what's called septic emboli, which is pretty much a ball of infection that can go anywhere in the body. And the big things when we talk about the central nervous system or brain, you can get meningitis. Have I seen it? Yes. Have I seen all of these things? Absolutely. Have I seen them multiple times? Too many to count. Does it suck? Absolutely. We also see epidural abscesses, which are infections that can sit in the spine and result in paraplegia. Where someone will feel fine, they may have a little bit of back pain one day, the next day they can't walk. And it's because that ball of infection is set up in their spine, is compressing their spinal cord. And many times these people may not regain the ability to walk. You also see young people having strokes from these septic emboli or balls of infection going to their brain. And that results in 25-year-olds who can't move the right side of their body, who can't talk, who frankly could have locked-in syndrome or could be bedbound for the rest of their life with the inability to do anything but lay there. When we talk about the heart with regard to opiate abuse, you can have an infection in your heart valve, which is called endocarditis. And this sets up in heart valves and in turn can result in those septic emboli or those balls of infection going throughout the body. It can also result in your peripheral venous system collapse, meaning the veins in people's arms and toes, legs, everything. We have no access for these people in order to get an IV in and to help them. Respiratory-wise, this is, when we hear about the overdoses and we hear about people dying, this is one of the most common reasons people are dying from opiates. Opiates have an effect on the body and result in respiratory depression, meaning people slow down their breathing. They're not breathing as deep, and they're slowing down the amount of times they breathe in it. So they end up having hypoxia or low oxygen in their body. And they're pretty much drowning. And people, when they have to go do a respiratory arrest, then they have a cardiac arrest, meaning their heart stops. And then they come in many times to the emergency department, and I will do everything I possibly can to save their lives. But I don't want them to end up in our emergency department. I want to do everything we can before that, and that's why I'm here today. Along the same lines, people can get aspiration pneumonia because they're so out of it. I'm sure you saw the pictures. These people have no clue what's going on around them because of what this drug does. When we talk about GI effects in people's bowels, you can have narcotic bowel. We're seeing it on when we're watching sporting events. There are commercials about it. There's drugs out there now for people who have narcotic bowel. But narcotic bowel is going to ultimately result in slowing down of your bowels. So people that are using opiates, it has an effect in the GI tract, and it slows down your bowels and causes constipation. But it can also cause very uncomfortable things for people, like what's called a fecal impaction. And that means you've got a big ball of stool that's sitting in your bottom and you can't pass it. And so I have to use my finger to dig that out. It's not pleasant for me, and it's very unpleasant for a patient. But if they don't, and we can't do it that way, they end up going to surgery, and they have to have portions of their bowel resected because they have that much stool that's sitting there and can't move. You also see, problems with liver failure because of the opiate abuse and its metabolization through the hepatic tract. Now, when we talk about the kidneys or the renal effects, a lot of times heroin can cause nephropathy or can shut down the kidneys, resulting in people requiring long-term dialysis, meaning 3 days a week, 3 hours each time, hooked up to a machine because you can no longer urinate because your kidneys aren't working. When we talk about infectious disease, everyone knows, if you're using IV drugs, there's a potential for HIV and there's a potential for hepatitis. And they're out there, and it's only a matter of time. It's not about an if, it's a when, in this case. And you also have the potential bacteremia, which is, again, bacteria going throughout your whole body. Because what's being utilized is not a clean thing. When I do things in the hospital, I do everything I can, and I tell people, I am anal retentive, I'm going to clean off your skin, I'm going to clean off your back 3 times before I do this, because I don't want you to get an infection. But this stuff, there's feces in it sometimes, there's elephant tranquilizer like we've seen up in Akron, and people were just arrested down in Cincinnati for it. Then opiates' effect on death. Every single one of those people died from an opiate overdose, whether it was illegal heroin or it was prescription narcotics. So we talk about addiction. We go back to the dopamine release in the body and the upregulation. Ultimately, that's where opiates cause the addiction, because our body gets so accustomed to that up release of dopamine that normal levels, what were previously normal for us, no longer work for that pleasure, for the memory, for our mood. So if we compared that to going out to eat, and we took, we went to a restaurant and we ordered every single thing on the menu, and we ate every single thing in one sitting. That's like the equivalent of that huge dopamine release. So you can't go back to that restaurant and just have one meal. You're not going to feel full anymore, because your body has become so accustomed to, well, last time I was here I had everything that was on the menu. How can just one meal be enough? So in withdrawal, when people withdraw from opiates, which is, again, the natural progression, because people's bodies become accustomed to this, and their whole body does. And every body system that's affected by the drug's use is also seen in that withdrawal picture. And when we talk about that withdrawal can happen within 24 hours of someone's last use. They have muscle aches, they feel like they have the flu, they hurt everywhere, they have increased anxiety, they have trouble sleeping, they have uncontrolled vomiting and diarrhea. I've seen 20-year-olds who have to wear diapers because they cannot control their bowels as they're withdrawing from this. It's real. It's not hidden. I see it every day. So Narcan, which I touched on a little bit earlier, Narcan is now available over the counter. And that is an antagonist for opiates. So it reverses their effect, but its half-life is limited. And when you start mixing things in like carfentanil and fentanyl, which have longer half-lives than the Narcan, that's where you run into trouble. Because people start using, and if they overdose, and now this is over the counter, and they reverse it, they could go back in about 30 minutes to an hour. That's why it's my practice when I have someone that comes in and has overdosed, I watch them for a set amount of time because, frankly, I don't know what's out on the street right now. And I have to do everything I can to make sure that they don't go out and fall over because that drug had effect again as soon as the antagonist wore out. Narcan is a wonderful thing. It really is. It's helping save overdoses, but rehab really is going to be the thing that saves lives. And that's a big thing. It's not Narcan. Narcan's not going to stop someone from using. It's a big thing you need to understand. It's the rehab that's going to be the big lifesaver. If we go back to 2015 where we said 3,050 people died from overdoses, we also saw a huge increase in the amount of EMS administered Narcan. Almost 20,000 administrations. So arguably that number would be much larger had we not administered that amount of Narcan. There's resources for help. Many of them are included in the handouts. If you know someone that needs help, please help them. We're trying to make sure that there are more resources available, both locally, statewide, and nationally. Right now is Opiate Awareness Week per President Obama, who signed something into effect on the 16th, that this week is Opiate Awareness Week across the nation. And he's trying to make sure that we have more funding for resources because that is a great deal. I hear it every day. I need help, but nobody has an open bed. Thank you. I just want to say thank you real quick to Kelly Shively before she exits in the back, and Laura T-Berry from our office who've been a huge help in putting this all together. And again, thank you all for coming tonight. I hope nothing was too disturbing. If you do have any comments, I believe we have a comment sheet for you. And if you have any questions, I'm available. Yes?
When it's being non-preventative prescription, as far as the problem is how it's in positions like starting narcotics or
Again, I'm going to just rewind that. I'd say physicians are not prescribing narcotics for everything. There are certain instances where they are accepted. Do I prescribe them? Yes. Is it important to make sure that you take them in limited quantities? Yes. Is it important to have open conversations with your doctor about what medicine that you might be starting on? Absolutely. And there is education out there that we're working on in terms of from a physician and medical standpoint to make sure that we are aware of the dangers. This past, I think, right around Labor Day, the Surgeon General sent out mail, hard mail, not email, hard mail. I got it at my house. Partners of mine at work got it. Every single physician in the country received this mailing from the Surgeon General talking about the dangers of prescribing narcotics and what we can do to make sure that we're doing that more responsibly. And if we, talk about that a little bit, in the late 90s, we started talking about pain as the sixth vital sign. That was something that was hammered into medical education for the longest time. Pain is the sixth vital sign. You need to be aware of that. You need to make sure people are comfortable. And I have an open conversation when I take care of people. I want to make sure that you're not in horrendous pain, but an ankle sprain, a broken, forearm once it's splinted. We can focus on Tylenol and Motrin, which are great over-the-counter drugs that work wonderfully. And again, I'll go back to that fact that pain is the body saying, something's not right, you need to rest this.
I'm curious as a parent yourself, at what point do you have conversations with your children proactively?
So I'll admit my kids are extremely young right now. oldest is in 1st grade. And I think, I have not had a conversation with him or my kindergartners or my preschooler yet. But I think by the time they're in middle school, I will have that conversation with them, and they will understand. I'm pretty upfront with my children in terms of they know what I do. They know what Dad does. And I think it's important that, once your kid's at that maturity level, I think John's got 6 now, so he can probably touch on that a little bit more. He's one of my colleagues in the emergency department.
So I was live here. Is this on? Okay. My name is John Nagel. I was alive in the 70s. I was young, I don't remember, but I was alive in the 70s. And I'll tell you a few things about why this topic hits home for me a bit. I practiced for 5 years in Evansville, Indiana before I moved to Columbus. And while I was there, I taught the youth Sunday school program at our church. And one day, I had only been living there for maybe 4 or 5 months at that point. One of the high schoolers in my Sunday school class came to me and said, "You'll never believe it. Somebody at school was selling pills out of a bottle that had your name on it as the prescriber." And that just shocked me. And I don't know if this was medication prescribed to the young person because they had some major injury, or if this was, a prescription written for their mom. And it might not have even been for the particular drug. Maybe that was just what they were carrying. But it really struck me that I need to be aware of what's going on. To answer your question, as Dr. Squire said, I have 6 kids. My oldest is a senior in high school. My youngest is still a toddler at home. I start talking about this with my kids before they're out of elementary school. You've got to adapt the discussion according to their age. It's not a one-time discussion to have. It's something you need to have repeatedly with your children. We have very open discussions in my home about this and other topics because your kids are... How many hours a week do your kids spend at school? How many hours a week do you have face-to-face contact with them? They are exposed to a lot of things that we're not necessarily going to be aware of. And we have got to take advantage of the time, even while they are young, to let them know what's going on, to let them know what to expect, and to teach them how to address it when it comes up. So that, like the video of the young guy who's getting pills at a party, they know how to say no. Yeah, go ahead.
How would you suggest that we dispose of these medications that we're in?
So on the pamphlet, if you picked up one of the pamphlets, there's a Purge Your Medicine cabinet. And if you go to that prescriptiondropbox.org, you can find a local area where you can dispose of those medicines safely. So that's why we include that, because I think that's a huge, huge resource, and I want to make sure that again, people understand and take advantage of that.
Would you please let us know also why we should not put them down the toilet or down the sink?
Well, we don't want them in our water supply. That's, the big thing is, if we start putting all types of drugs down into our water supply, we can't get those out. And so we want to make sure we're getting rid of them in an effective manner. And we frankly don't want a whole bunch of narcotics that's in the Delaware water supply.
To somewhat go to that point as well as answering your question, one of the responsibilities we have as physicians, as Dr. Squire said, we aren't innocent in this game. There's been a pattern, and we were taught in medical school that we have to be very aggressive about pain management. And now we're learning that we've made some mistakes. When you get a prescription, talk openly with your doctor about how much do you really need. My oldest daughter, as I said, is a senior in high school. She just had her wisdom teeth out last week. And the oral surgeon, I spoke with him about some of these issues. He talked about how his practice in the past had been to write for 20 pain pills after the surgery. It's a significant surgery. You can expect to have some pain, and pain that's not necessarily going to be relieved by over-the-counter medications. It's not that there's no place for these drugs, but there's an appropriate place. This oral surgeon said he changed his practice about a year and a half ago. Instead of prescribing 20 pills, he prescribes 6. And he does this surgery all the time, every day, every week. And he says in a year and a half, he has only twice had a patient call in asking for a refill, because 6 was enough medication to get them through the first couple of days when they have pain, and then they can taper it down to over-the-counter medications and use other things besides medications to help with the pain. So one element of getting rid of the excess pills is to not have them in the first place. So talk openly with a prescriber about how much drug you're getting and how much do you really need. Let's not get into this mentality of, I need some extra in my cabinet in case something happens to me 6 months down the road.
I know that Dublin as a community has really kind of curve as far as drug feedback and things like that. They actually have not 24/7, they have a box on site right outside of the police station, and just drop off drugs pretty much like probably 7 to 7 p.m. or something like that anytime. And we're hoping that more and more communities like ours will do the same thing. The problem has been our lack of willingness and ability to talk about it and acknowledge that this problem exists, not just in the inner city, but where we live. Hopefully we'll see more and more of that. So pharmacies will take it.
You think your teenagers are very good about hiding things. What do you suggest as far as signs and symptoms, particularly for medicine? The obvious with the skin feeling off. There are other signs, like pupils. What are the things that parents look for signs and symptoms of youth maybe high on these medications?
You know, I think with regard to signs, symptoms, if you're looking at your kid, that's you. If you're looking your kid in the eye, if they have opiates on board, their pupils are going to be very constricted. They're going to seem kind of lethargic out of it. If they start acting, you know, if they were otherwise a pretty outgoing kid and really open with you, and then all of a sudden there's this huge shift in their attitude, and they're more secretive, and they're hiding, and they're doing things, you know, away from you, in their room with the door shut. It's things to, you know, raise questions. If you find a pill bottle, the big things, you know, and that's where opiates is something that's different. If your kid drank alcohol, they might come home and you can smell it on their breath. If your kid went out and took a pill, they might walk past you and you not think anything of it. And that's the scary thing is, and when I go back to, I said earlier, this is a lonely addiction and a lonely drug. And that's because it hides. It hides in your neighborhoods. It hides in the park. It hides in the school. It's there. And many times it might be right next to you. And you won't know. You could be driving your kid to a friend's house or driving one of their friends in the car. You know, they wouldn't be able to have a case of beer in the car with you, but they could have a prescription bottle in their pocket. Yes.
I guess that's not so much question, but I think from what I'm seeing at depression this year, is I think us as parents need to do a really good job of knowing where kids are going. You know, when my son goes somewhere, the first thing I do is call or say I get a phone number. If I have another parent, I go into the door to meet the parent, and I kind of tell you how many parents don't do that. I have kids in my house all the time, I've never met and they're putting it on social media. So they're not smart enough yet to hide their life, but they're going to get smarter. And so I think as parents, we need to just be involved, not only at the dinner table, but knowing where our kids are and calling. And I don't care if my kid is mad at me because I have to go to the door and he knows now. He's like, that's it, Mom, go ahead. You can introduce yourself. You can meet them. He knows that because then I said, if I get in the car and I'm not comfortable with the situation I'm in with them, you're coming back home. You know, I don't care. I don't care how mad you are at me. I'm not here to be your BFF. I don't care. All your friends think I'm, in their grill and check up on them and, follow them on social media. That's my job. And and so I think it's a way to call to all of us too. We have, we have a tough job, keeping up. So I think that's a big part of it too.
Yeah, 100%. Yeah.
I think that it's younger the better. I mean, in third grade and second grade, when it comes to those people about drugs and, what goes on, I work with social classes too. So I see a lot of that too going on. So that's just my talk to the middle schoolers.
So again, you guys are the first people that have heard this. So this is still it's in its infancy. As an emergency medicine doctor, I realize sometimes that the things that I think are normal and the things that I might talk about at home will seriously bother people and seriously bother, they make for good stories though for, people we know. But it is something that knowing that and knowing that, some of the images aren't appropriate for kids to see. And trying to, again, my resources are limited as I work, full-time and go home to 4 kids, and my wife, Amy, would prefer that I still stay focused at home. But, if we can get the message out to middle schoolers, I think it would be great. And it's, again, finding that avenue, what's the best method to make sure that they're educated. I think the biggest thing is making sure parents are involved and are aware this is out there. And it's in our community, and it's definitely tangible. I'm going to go right behind you and then I'll come back to you. If they're over 18 and they're in the emergency department, you might receive a call from me saying your son, your daughter, your wife, your husband is in the emergency department. What happened? I'll speak with you when you get here. And I can't, it's frequently I run drug screens. Frequently I have to run alcohol levels. And if a person is over 18, I can't discuss those results with family members. I am in 100% agreement with you, but when I have these discussions, I'll tell you what I do, because I know that I'm legally not allowed to tell that, and I could have somebody sue me because you aren't allowed to tell someone that information. So what I do is I sit down with mom and dad in the room, say, Mom and Dad are here because you came into the hospital. Can we talk a little bit about why you're here? I don't want to. And again, it's prying them to make sure that they look at your parents. Look at them. They are crying. They are scared to death because I called them about you being here. Let's tell them why you came in. Because I think it's important, and I think it's important that the patient, as whether it's a child, if the kid's under 18, I will tell you 100% of the time. I'll tell you that hands down. But if they're over 18, because of the law, we can't. But I will do everything I can to make sure it's painfully obvious and that child will share that. And unfortunately, what addiction is, most people who have to go through rehab, any idea how many times they go through rehab for opiates before it's effective?
3.
7. 7 times is the average number of times someone has to go through rehab to recover from an addiction to opiates. And the most dangerous time for an opiate addict? When they get out of rehab. because they go back and they use that same dose that they used before they went in, and that causes them to overdose. And unless someone who's addicted to opiates is 100% on board with getting off of them, it's almost a moot point. So if we can do anything we can to prevent them from going down that road, we have to. But I know what you're saying, I get it, 100%. And there are certain things about what I do that I don't like. And I don't like that I can't do that, especially when I have a concerned family member that's at that site. But again, it's, you know, my medical license, and it's happened. You know, people get sued, and it's, well, you actually did disclose medical information, so. The HIPAA law has been in place for many years, and I'm in, you know, agreement. There are instances in there, and that's a whole different discussion. We could talk at length about that. But there are problems with it, and I will agree with you there.
My question is, how do we get involved? I'm a paramedic for Delaware County. I left for about 6 months, 4 months ago, came back. I've exponentially seen the difference in just the last 8 months in our county. I mean, just yesterday, in the winter, like in Delaware County.
Yeah.
Just last week, in Delaware City, right outside the EMS station. So, how do we get involved? Where do I sign up?
I think the biggest thing is just educating people and educating our youth. And, you know, my kids, again, they're very young. But if, you know, once they're old enough and it's obviously an open, like, I'll have that conversation with their friends. It's something that it bothers me seeing it because, and you see it, people don't care. They'll sit in their car with their kid in the back seat and do it. This isn't going to a bar and drinking, you know, alcohol. This is you don't care about anything but that drug. So, again, anything you can do to educate, get out there and do it.
Not that we aren't trying to help people who are already on that lonely path, but the message tonight is prevention. And what we need you to do is go home and talk about it with your families, and with your friends and your neighbors, and the next time we have this discussion, we can fill the auditorium, and we can get other schools involved so that we have more people involved with the prevention side of it and not trying to fix something that is notoriously difficult to fix.
In my opinion, the prevention starts when we have this work, because as parents, we have to engage with our children, and not as there around the table all together. We put all our screens off, and we I have about this. That is showing one good drug in the house. When someone is not doing a nuclear or whatever, there's correlation to what we want to abuse. So you do that, you know, with the dinner. So, you know what's going on.
And there's a book, I have obviously no financial interest in this, but it's called Dreamland. It was written by Sam Quinones, and he's spoken kind of to the same thing, in that our culture nowadays, from what it was 20 years ago, our culture has done everything possible to make the opiate issue what it is, and make it survive and thrive like it is right now. And that it is, again, going back to that, it's a lonely, it's an isolated. And with all the screens we have nowadays, and how busy everyone has become, and the quick, well, you know, I need something for this right now. I can't deal with this pain. I gotta go, you know, I gotta go to work. It's kind of fed into that cycle. And in the past 15, 20 years, I mean, if you read his book, it focuses really on Ohio. And it focuses on the fact that we really have fed this epidemic, and we need to do something to start it.
Dr. Squire?
Yes.
Will you be available for questions?
Yes.
Okay, you have a survey in your packet.
I want you to be very respectful. He's got 4 little ones at home. I can do work tomorrow.
Yeah.
Okay. I want to make sure that you get home to his family. There is a survey that they are very interested in you filling out. If you could do that and get some feedback, that would be great. A couple minutes afterwards, if you have questions you want to ask.
Yes.
Are you okay with that? Okay. All right. Thank you very much. Thank you for joining us.